Hello everyone, it's Makeda Valletta, also known as the Body Scientist, and I hope you all are doing well today. Um, I am currently live on my IG page, the_body_scientist, and I'm also recording this video on a different camera to post on my YouTube page, the Body Scientist 81. So if you don't follow me in both places, make sure you do. In case you're unfamiliar with me, I have a background in exercise and sports science and nutrition science with a little bit of biotechnology. Today, I wanted to talk to you all about the effects that the COVID virus has on our gastrointestinal tract, okay? Because we've constantly been hearing about how it affects our respiratory tract and how it causes issues breathing. But it also can cause issues in other organs. And the reason why is because the virus binds to ACE2 receptors on our cells, okay? And we have ACE2 receptors on our lungs and the linings of our lungs, but we also have ACE2 receptors all in our small intestines, okay? And we also have them in our colon, our esophagus, and also the liver, and the pancreas. So all those organs can be affected. A lot of people are having gastrointestinal symptoms, and this is not talked about nearly enough. So some of the stats on that is that over half of the cases of COVID positive cases have tested positive in the stool, okay? Because they're doing the nasal samples, but when they do stool samples, over 50% had active virus present in their stool. And it's now known, and I said this in the very beginning, that it can be spread through fecal matter. So, oral fecal route. So what does that mean? That means that when people go to the bathroom, right, when they flush a toilet, they should keep the toilet seat down. Because if you're sharing bathrooms with other people, and you flush a toilet and the toilet seat is up, if there is active virus in the feces, it can spin out into the air and remains in the air for a certain time period. I know that sounds gross, but that happens. That's also the issue with public bathrooms as well. So people have to be really careful of keeping the toilet seat down when you flush and keeping the bathroom very clean, right? But also, it's also been found some people have gastrointestinal symptoms and they never get symptoms in the upper respiratory tract. Some people never get respiratory symptoms at all. It's only in the gastrointestinal tract. And there are many people who never test positive for COVID up here in the nasal respiratory area, but they only test positive in the fecal. And it's also been found that when people do have respiratory symptoms, okay, like sometimes weeks after those respiratory symptoms have cleared up, there are people who are still having active virus in their feces, sometimes up to 5 weeks later, okay? And there are, also, some people initially test in the respiratory tract. Oh, you already said that, okay. Okay, so another thing is that the virus is thought it can be killed by acid, the stomach acid. So if you were to ingest the virus, and that's how, one of the ways it probably gets into your gastrointestinal tract, could be from ingesting it and swallowing it. If somebody has adequate stomach acid, it's thought that it should kill the virus, but people who are taking antacids, that can be an issue. And there's not enough scientific research to say that, but if you kind of use common sense, and you're taking things to reduce the acid in your stomach, it can also make you more susceptible to viruses, okay? And so, also the ACE2 receptors that I told you, that's what the virus binds to in the lungs and the tissues. But we have 100 times more ACE2 receptors in our gastrointestinal tract than we do on our respiratory tract, in our lungs and stuff, okay? And once the virus binds to the ACE2 receptors that line our intestines and it gets into our intestines, it is shown to start to destroying the bacteria, okay? And people always know, people that follow me know, I always talk about taking probiotics and how important that is. Actually, you definitely want to eat fermented foods, first of all. everybody should be eating fermented foods daily. So that could be raw dairy, fermented dairy, yogurts, kefirs, sour creams, raw milk, or it can be fermented vegetables and fruit, okay? So everybody should be doing that. Then as a supplement, this is a really good one. This is Garden of Life, okay? Garden of Life probiotics. This is the only company that I think is worth taking. It's the most potent, and I have other videos where I talk about that. They have different ones in their line. This one is 100 billion per pill, 100 billion CFUs, which stands for colony forming units, and 34 strains, okay? A lot of the probiotics that you buy, it might be 5 billion per pill, but like 5 strains. So this is much more potent. And right now, I take like two or three of these a day. But how much somebody needs to take or should be taking depends on a lot of other things with their health and their previous health and yada, 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 medications and all that. But your first line of defense against infectious disease is your good bacteria. And 70-80% of our immune system is in our gut, okay? So the fact that that's true, and then to find out that once the virus gets entry into your gastrointestinal tract, it starts to kill off a lot of the bacteria and change the gut flora, okay? So this is the reason why, for me, taking probiotics, I've always thought of it as, it's a war. It's a war inside your body. You have your own microbiome. You never want the bad bacteria to outnumber the good bacteria. That opens you up for all kinds of infectious diseases, among other things, okay? Among other things. So, certain symptoms of COVID gastrointestinal symptoms is diarrhea, really bad stomach pain, vomiting, nausea, and people who just get diarrhea out of nowhere, like you don't have any gastrointestinal issues that you know of, but then all of a sudden you have really bad diarrhea, you might have COVID, okay? And so this is why it's also really important to, I think, drink medicinal teas, okay? And combining herbs can make it even more effective. So if you have like green tea and echinacea and ginger. Ginger is very good has an affinity for the gastrointestinal tract and the stomach. So, and the ginger also helps increase the circulation. So like maybe ginger, green tea, and echinacea. Probably golden seal might also be good. The oregano and thyme tea is also good for infections and especially in the chest. So just consuming teas that are antimicrobial, antiviral is really, really important, I think. And also, I think that doing castor oil packs on the womb too, on the intestinal area, can also help because it increases your lymphocytes. And their lymphocytes play a huge role in your immune system, and especially in the immune system in your gut. So if you were to be exposed to that, and I'm talking about a castor oil pack may be good, just preventative. I'm not really sure how good it would be if you started to get symptoms. I'm not really sure, but I do know that castor oil packs do help to strengthen your immune system, increase your immune function, especially of your lymphocytes. And one thing that they notice with the infection is that people who get really bad COVID infections, they find lymphopenia, okay? Lymphopenia means a decrease in lymphocytes, and they don't know if the virus is doing that or what. So doing things that can stimulate your lymphocytes and stimulate your immune system is really important. Also, I think that for women, vaginal steaming can be very good. Okay, if you're putting certain herbs that are very antimicrobial, like garlic, like thyme, like oregano, and doing vaginal steams, it also can get into your womb. And what affects your reproductive tract also affects your gastrointestinal tract. So I think that could also be a useful, just preventative measure, okay, because I'm all about prevention. And just, being very much aware of these gastrointestinal symptoms. There's a lot being learned about this virus every day, and so I've been keeping up with it, being the nerd that I am, and I want to report back to you guys as I learn. I also have friends. I have a really good friend who is one of the lead scientist doctors who's working on a vaccine for this virus, and he's been studying coronaviruses for 8 years. I personally am not a fan of vaccines, right? I personally am pretty much anti-vaccine, but I also understand the broad spectrum. You have some people, it's always, you want to get your immunity naturally, you know, and you want to eat healthy foods. But there are people who don't have access to healthy foods, and they might be in a really weakened state, and then maybe a vaccine may help them. So I'm not going to completely denounce them because that's a complicated conversation. But I will say that I'm pretty much anti-vaccine, but still, my friend that is doing this research, he's been researching coronaviruses for 8 years, so I'm able to ask him certain questions about the research. But I've had my own intuition about it. Like, when I find out about a virus or bacteria, I like to find out about the pathophysiology of that virus or bacteria. So that means, how does it work? What is it doing? So I immediately wanted to find out, like, what is the pathophysiology of this virus? And finding out that it binds to ACE2 receptors in the lungs, I immediately thought, where else in the body are there ACE2 receptors, you know? And then you're finding out they're all, you know, in different places, including the intestines, okay? And so we do know that people who have the upper respiratory tract issues, the upper or lower respiratory issues, a lot of them have damaged lungs and decreased lung capacity because of scar tissue that's left in the lungs. And so it's not known whether or not it will cause any kind of permanent damage in your gastrointestinal tract, okay? So this virus is very serious. Also, they're finding that a lot of people who have gastrointestinal symptoms, not always, but a lot of times they have more serious forms of the COVID virus later on. And that could be because in the early stages, if they didn't know they had it, it was undiagnosed, and they may not have been, it may have been there longer, you know, I don't know. So I just think it's really important for us all to treat ourselves and the people around us as if we have COVID. So it's really important to take care of yourself all the time because you never know when you could be exposed to infectious disease. So that's in general. But at this moment, when we know that there's a highly infectious disease floating around, it's really important to do all that you can to keep yourself healthy and strong, eating healthy foods. And I talk about that a lot in my YouTube videos because one of the reasons why so many Black people and Native people, too, are succumbing to this is because of nutritional deficiencies, specifically vitamin D and other deficiencies that come from moving away from your traditional foods, okay, and traditional ways. And I talk about this a lot in my other YouTube videos on this subject, so be sure to check that out, okay? I'm trying to see if there's anything else. So yeah, you know, people who have IBS, which is irritable bowel syndrome, people who have any of those kind of issues, you need to be extra careful because you could possibly be more vulnerable to a bad infection. That could be an underlying comorbidity, you know, because remember, much of your immune system is in your gut. You have all these ACE2 receptors, and if you already have Crohn's disease or irritable bowel syndrome, then I'm pretty sure you already have a serious imbalance of bacteria in your gut, okay? So if that alone could open you up to being more susceptible to this, your gut's already not working properly, and most of your immune system is in your gut, okay? Remember, our immune system is in our skin, it's in our gut. It's really important how you take care of your gut and how to take care of your skin. Also, bone broth, okay? Which I'll be doing a more detailed video on tomorrow about all the scientific properties of bone broth that make it so important for our immune system and for our gut. Okay, so consuming a lot of bone broth right now, I've talked about this in other videos, is critical because not only is it really important for our immune system, it's really important for the integrity of our guts, okay? So, gotta take care of your gut and your immune system and pay attention to that. Understand that severe gastrointestinal issues of diarrhea, vomiting, serious stomach pain, nausea are also signs of COVID, okay? And this is not a time to wait until a doctor to save you or wait for a doctor to diagnose you because that may not happen. So it's important to take care of yourself, pay attention, be diligent about your health, okay? I think that I might have said everything I needed to say on this topic. Every time I record a video, there's stuff I remember that I meant to say that I didn't say. So I think I might have said everything. I mentioned drinking the teas. I would drink it every day. Every day I have green tea and echinacea tea. I try to get ginger in my life. When I cook, I try to cook with garlic, ginger, other medicinal herbs. Definitely the probiotics, critical. The fermented foods, critical. And the broth. That should be daily, okay? Daily. All right, people. So I wish you all the best health. Take care of yourselves. If you like this video, please like it. Please share it. Make sure you follow me on YouTube, The Body Scientist 81, and on IG, the_body_scientist. And I hope I said everything. Okay, peeps. Have a good day. Bye.